Well, I think what makes aflbercept unique is the pan blockade you get of VEGF-A and all its isoforms. At the same time, it has very, very high affinity, and that makes it a very potent agent that suppresses VEGF levels well. From a placental growth factor, we know that this is second arm or second mechanism of this drug, and it's very effective in both reducing permeability, blocking placental growth factor, but at the same time it does a few other unique things. It's been shown to decrease pericyte loss in diabetic retinopathy, which is a fundamental mechanism of diabetic retinopathy. It's been shown to decrease fibrosis, and it's also been shown to decrease the neurodegenerative process that takes place in diabetic retinopathy. So this mechanism, both the anti-VEGF and the placental growth factor inhibition is a critical role of how this drug, I think, works and why it works so effectively.
The key features of aflbercept that make it an excellent choice for patients with diabetic macular edema is the data. The data itself in our trials, which are comparing all drugs, show it is the best drug in treating patients with diabetic macular edema. Patients who have lost vision gain vision better than any other of the other drugs. Second of all, we have evidence now that this drug can actually regress the disease process in the eye. That is, we can actually turn back the clock and put the diabetic eye disease into a much earlier stage.
What I try to do is go back to the scientific literature and the clinical studies we have to guide our treatments. We know from the post-hoc analysis from the VIVID and VISTA trials that every single injection, the loading dose, the 5 injections we give, you have a significant increase in number of patients who see 1 line or more, and a very small number of patients who lose vision. In fact, that ratio is 2 to 1 consistently after the 2nd, 3rd, 4th, and 5th injection. So a lot more patients continue to gain vision as part of that loading dose. And I think that's an important factor. We must think about loading doses. So I think given that, what the studies on diabetic macular edema are demonstrating is that unlike AMD, in diabetes you get a steady increase in vision over the first 5 to 6 injections, and the vision gains sustained for 6 to 9 months. Or it's continued to increase for 6 to 9 months after the loading dose. So it's more of a chronic disease, and I think that's hence the loading dose is important, because you continue to get vision gains in the long term.
The loading dose for aflbercept, that is the 5 to 6 injections monthly, are very important in controlling the disease. It shows through the data that we have very good results when we do it through these protocols. Why I think it is important is really because of the mechanism of the drug and how it works. I practice this in my own practice and teach this to the fellows and residents because this is the best data that we have at controlling diabetic macular edema. And with this, we will slowly eradicate the visual loss that is from this disease.
Well, I think any positive data that helps patients is impactful. However, the group you're referring to is the group that has already lost vision. And this is a group, their motivation to come back and put up with the treatment burden is to get recovery in vision. And that's why the 75% number is so important that we can share with our patients. They know that 75% of them will get 20/50 year vision, and which is a significant improvement in vision for them, and has practical implications. For instance, driving vision in Ontario, Canada, where I'm from, is 20/50 or better. So these numbers actually have very practical significance for our patients.
The importance of having the patients worse than 20/50 vision improve significantly to 20/40 vision and better in over 3/4 of the patient population is extremely important. 20/40 vision and better is driving vision. So we can take patients who are illegal to drive a car through vision testing, and by after treating with this drug, we can get them back to visual acuity sufficient to drive in the legal means.
Well, I think multi-targeted, safe, and a potent agent that's very effective in controlling diabetic macular edema.
Efficacious, safety, and robust.
It's based on the best clinical data we have to date that 5 loading doses will lead to the best results for a patient. And I think as clinicians, it's our duty to pay attention and heed to the clinical research that's already been done and can guide how we manage our patients.
Intense monthly treatments will result in excellent visual acuity.